Good morning, I'm Vladimir Norman, and I'm with the United Nations Foundation. This afternoon, I have the great pleasure of introducing our first panelist. The conversation is entitled Women in Crisis. Please join me in welcoming Savannah Guthrie, co-anchor of the Today Show, Sienna Milner, International Medical Corps Global Ambassador, and Rebecca Milner, Vice President of Institutional Advancement for the International Medical Corps.
Where do we This is such a large couch.
No.
We'll just snuggle up, shall we? I know, exactly. Everyone gets their own cushion. Hi, everybody. Welcome. It's so good to have you here and to start this panel. And I'm, as you heard, joined by two distinguished activists, Rebecca Milner and Sienna Milner, and so happy to do it. So the International Medical Corps is involved in great work around the globe. And I wanted specifically, Rebecca, to talk to you about the work you're doing with regard to women and children. And, something that I hear a lot of policy leaders say often that happens to be true is, if you want to know the health of any society, look at its women and children.
Right.
And I'm sure that that's something you encounter all the time.
Right, we do. And I mean, I guess just to put some context in, we heard yesterday from the UN that currently there are 60 million people forcibly displaced from their homes. 80% of those people are women and children. Natural disasters are on the increase. On average, there are 700 natural disasters a year. And war and conflict are everywhere. I mean, I think they are in the front pages. In the past 5 years, 15 different conflicts have erupted or reignited. And it's South Sudan, it is DRC, it's Libya, it's Yemen, it's Syria. And at the center of all of that are women. And often in conflict, women are targeted. And these conflicts are brutal, and they target women specifically because it reaches into the heart of society. If you target a woman, if you rape a woman, if you attack a woman, you devastate her family and you tear apart the fabric of the community. And it's deliberate. But even in natural disasters, women are at greater risk. And so we focus on life-saving interventions. So emergency medical care, clean water, protection, access to shelter, all of those things. But you also have to remember that in the midst of war and disaster, life goes on, right? Women are still having babies, children are still getting sick. You have to prioritize access to healthcare, and you have to focus on women. And if you invest those resources in women, you're going to have a greater life-saving impact.
We've obviously been watching what's been happening with the refugee crisis coming out of the conflict in Syria and in parts of Iraq. And Sienna, you were in Lebanon a year ago, so you witnessed this firsthand. I'm curious what your impressions were in general, but also with regard to how women and children are faring in this situation.
It was a really interesting trip, actually, because we had every intention of going and visiting several different camps, but while I was there, a bomb went off at a checkpoint that we had just driven through. And so the whole trip was kind of cut short. It wasn't vastly different to any of the refugee camps that I visited in terms of the fact that, I suppose what was really prevalent was the psychological impact of what had happened, of what they had fled, which was criminal warfare. And the women and children were in huge distress, understandably, and psychologically really affected. I think, you know, it's the equivalent, once you flee a conflict in that way, it's the equivalent of being imprisoned, and these people are imprisoned, and there really is no hope, no solution. I think Lebanon has been exemplary in the way that it's handled the refugee crisis. It's extraordinary, the volume of people that they have taken in, and the way that they're managing education, and I really think Europe has to step up and look at you know, what we should be doing better.
What are the needs that you see? What are the practical needs?
The practical needs are the same, aren't they? I mean, just well, you
Right.
you're the
No,
expert.
that's exactly right. I mean, it's access to healthcare. It's women need to be in a safe place to have babies. Their children need medical care. I mean, diarrhea, upper respiratory illness, all of those things. I mean, people need nutritional supplements so that their children aren't malnourished.
And also education, you know, for school to continue, and also mental health care, attention to mental health issues, which are really substantial after what these people have been subjected to.
Well, it's true because people think of a refugee camp. I mean, by its nature, people think, oh, this is temporary. And now we're talking about people who have lived there. This is their new life.
Right.
I think the average, someone told me that the average, once you are displaced, the average time that you will remain displaced is 17 years. That's the statistic, which is just unfathomable. You know, you just can't imagine that once you've made that decision to leave, really, because there is no alternative, that's it.
You started this work, I want to say, was it 7 years ago or so, with the trip to the Democratic Republic of Congo.
Yeah.
What did you learn during that trip that has held true? What have you kept with you that made you want to continue to do this work?
I think that Congo is kind of one of the most intense places that you could ever really visit, and the epidemic of rape was what was so astounding. What had made me actually initially want to go was the statistic that a woman there is raped every 8 minutes, and I had no idea. I think nowadays it's much more known that there is this epidemic taking place, and it was devastating. It's devastating. I met 2-year-olds who had been gang raped. It was sort of, you know, the impact of what you see is completely heartbreaking, at the same time really galvanizing in terms of you know, the need for all of us to pay attention to the world that we're living in. And we live a very fortunate, I can speak for myself, but a very privileged existence. And I felt hugely grateful to have the opportunity to become aware of the world that I was actually a part of. But the work that International Medical Corps are doing there is phenomenal. And there is a lot more focus on women's issues and on the Congo in particular. But I think that was a really interesting thing is to realize that there is psychological warfare taking place in these places, that not only are people displaced, not only are they fleeing conflict, but the epidemic of rape was really not a sexual thing. It was a means of kind of destroying the dignity and breaking humanity, and that was devastating.
It's a weapon of war.
As a weapon of war, forcing a husband and children to watch. And then the husband would leave the wife, he couldn't stay with her. You know, it's just destroying people at their most vulnerable, fundamental human level. So that's why this is so great, to be able to come and have these conversations and to work with an organization like that to support them, because they really not only provide incredible medical care, but also socio support, mental health support, all of the things that are really necessary, as necessary.
Rebecca, tell us about the work that you're doing, what it looks like in these places.
Right. I mean, so these environments that we work in, the conflicts are so protracted, or the situation is so protracted. I mean, we focus on training, right, and giving women and health workers the knowledge and skills that they need to take care of their own communities. And so it might be a psychosocial worker in the Somali camps in Ethiopia that's been trained to help women who come in to sort of somehow restore their lives, have some semblance of normalcy and dignity. Or it's training midwives so that they can help women have babies in a safe environment. I mean, actually, if you're pregnant and if you have a trained health attendant by your side, your chances of dying are reduced by 70%. I mean, so that's the key. We need trained health workers for these mothers. I mean, 800 women die each day in childbirth. I mean, that's absurd. That needs to stop. You can't bring in enough doctors, you can't bring in enough nurses to help these people in these communities. So the only solution really is to train people to take care of them, take care of their own communities and take care of themselves. And so that's what we focus on.
And it's culturally respectable, isn't it? Mm-hmm. I mean, just the idea, I always used to imagine kind of NGOs going into crisis situations and like sticking Band-Aids on things and then leaving. But what I love about our organization is that we really focus on training locals to become self-sufficient. And actually, a program that I visited in Ethiopia is predominantly run by Ethiopians now, Daniel, the nutrition expert. And so it's culturally sensitive, and it's long-term.
when you talk to people who either in refugee camps or have gone through a different kind of conflict or natural disaster, because you do that work as well, I mean, what strikes you, Sienna, about what they want, what their hopes are, what they want the world to know about them? If you are an ambassador, you come, you speak to them, they want to speak to you and get their message out. What do you hear from them?
I don't know, it's really hard to articulate, you know, people's suffering. It just is, but I suppose, you know, they need help on every single level, and they need to feel like the world is paying attention and focused. It's really hard because there are just so many situations in this day and age. I mean, I think another statistic, but in 2010 there were 11,000 people displaced each day, and this year it's 42,500 a day. I mean, the volume of displaced people is just vast and growing, and I think it's really time to look at political solutions to these problems. I mean, it can't in this day and age be growing in the volume that it is, and people want support, they want to be heard, they want their homes back, they want their lives, they want the feeling of dignity, which is really hard to feel in an IDP camp. No matter what fantastic work NGOs are doing, I think politically the international community has to step up.
These are all socially aware people who are interested in this work and interested in making a difference. Rebecca, what would you say to people who want to be involved?
Well, I mean, I think you have to educate yourself and really be a global citizen, and what engages you, what galvanizes you, pick something and really dive deep and figure out how you can make a difference. And then educate your friends, your network. I mean, Naomi at Facebook, one of our partners, said yesterday she likes reading about what her friends care about. And so you can make a difference by educating others through your own networks. I mean, that's something that you can absolutely do. I wouldn't be a fundraiser if I didn't say mobilize resources to help. And you can do that. It's, you know, whether it's $10 or $10,000, I mean, every bit of money makes a difference. It really does. And then you have to advocate. You have to advocate for political solutions. I mean, there are no humanitarian solutions to humanitarian problems, as the UN says. There's just, you know, you can't bring in enough help. You need political solutions, and so you have to advocate for what you believe is the right way to tell our international leaders how to solve these problems.
And the same question to you, Sienna, in our final minutes, been what you think people should do. What would be your advice to somebody who wants to get involved? And also, to the extent you can, just reflect on what it's like to come close with that kind of suffering. I mean, I think so many of us, we see it, and maybe we want to put our emotional distance because sometimes it is so much to bear.
Yeah.
But just the courage I think it takes to plunge into it, get acquainted with it so that you can spread the word. I guess that's a note of encouragement to others to be involved and not be afraid to look at what's hard in this world.
I think it probably comes down to your disposition, but for me, there's something I really enjoyed about these experiences. I think I tend to process things on an emotional level, and so the actual experience of being sometimes in also really high octane, dangerous situations, like the adrenaline of that, if I was being really honest, it's a pretty phenomenal experience. At the same time, just the perspective that is gained is unimaginable. It's immeasurable to really, like I said before, but to try to have an understanding of our world and what we've contributed towards. And in Congo, that is really at conflict because of the mineral destruction. And, you know, I have an iPhone and a MacBook, and that's what made my computer. And, you know, understanding where, you know, our kind of footprint is incredible. At the same time, it's devastating and really painful and traumatic to see people living in this way. But like you said, there's tons that you can do to really make a difference and to get involved. And at International Medical Corps, I think 90 cents of every dollar donated goes directly to the field. You know, really research the organization and the areas that you're passionate in, and then find out what you can do to help.
Yeah, I mean, and there are amazing stories of hope. And
it's not all bleak.
Right,
It's exactly.
right.
It is a very inspiring experience.
Yeah,
I've seen I saw in Haiti a woman die and be brought back to life, and that happened. And it was like, it doesn't kind of get more phenomenal. She flatlined, and there was a 5-minute resuscitation, and it was devastating and hopeless in an intensive care tent. And 5 minutes later, while I was with her husband, who was bereft, her heart started beating again. I mean, that's the work that these people are doing. And I think once you have that experience of hope, God, it's really emotional, but you know, it's extraordinary to have been fortunate enough to experience that.
And you've seen those results as well.
Yeah, I mean, every day. I mean, there are so many incredible people that work with us, and people that we train. I mean, midwives in Noristan that will walk by foot for 90 minutes to help a woman in distress and deliver a happy, healthy baby. I mean, you know, for those women to sort of stand up against cultural conventions and say, I want to be educated and I want to help, and then being able to do that, I mean, it's amazing. And women, you know, are leaders. They're incredibly strong, and you know, that's the key, right? As you said in backstage, I mean, if you check the health of a woman, that's the health of a society. And I think that that's just really important for us to remember, and to continue to make sure that resources and attention is given to women in crisis.
Yeah.
Yeah.
I also think just on a purely a level of my own life, the amount that I see my female friends getting done while kind of cooking and arranging children for school versus the fathers, I think, you know, we'd have a 3-day week if the women were in charge. So I'm advocating for that.
That's a good point to end on.
Yeah.
Sienna and Rebecca, thank you so much.
Thank you.
And thank you to the audience for your time.
Thanks.
Appreciate
Thank
it.
you.